Care delivery system in Katsina State is on the brink of a crash as medical doctors in the state are overstretched due to paucity hands. This alarming situation is leaving the healthcare system in a state of crisis, with only emergency services being provided at some hospitals. Jamil Mabai was given an exclusive access to some hospitals from where he felt in this report.
Looking pale and exhausted, doctors in Katsina are overwhelmed with workload. In the last quarter, 25 doctors have left the state services. And according to Dr. Saminu, an additional 20 are planning to leave this month.
The state of affairs of health in Katsina State, so to say, is in a very sorry state. I will tell you every day where I work, I almost say on a daily basis, I signed resignation letters. In fact, on daily basis, they are living gravitating either within the state, migrating from the state services to the federal establishment or to the NGOs that we have in the state, or some of them have left for abroad.
In Ture Specialist Hospital and the State General Hospital, only emergency services are rendered. The situation is alarming.
Because of the shortage of manpower, the General Hospital, O&G section, they have to close down their gynae clinic. And it also happened the same thing in Ture. Because of the manpower, we cannot continue. We just have to provide emergency services only. Unfortunately, as I'm talking to you today, we don't have any ophthalmologist at that eye center today. When I took over, we have 3 pediatricians working with the state government. And now, as I'm talking to you, we have only 1 pediatrician remaining. That's in General Hospital Katsina. So, and then when you look at the subspecialties, like in the O&G, was the same story. At a time, we have about 6 gynecologists in the state. Now we have just barely 1 or 2 gynecologists working with the state government. It's the same story with other specialties. We have only 1 nephrologist, only 1 urologist, 1 neurosurgeon. So you find it very difficult, even those that are around, you find it very difficult to work.
With an estimated population of 10 million people, there are less than 100 active doctors available.
Mostly doctors look at their career progression. And then secondly is the remunerations, the welfare package, and then the working condition. You assured me of my own career progression, which is not applicable in the state government. And then the other issue is the working condition. I will tell you that we are, so to say, still offering a healthcare services that is more than 50 years old, because the equipment, the gadgets that we are supposed to use that are latest are not there. So you realize that even a specialist only offers some rudimentary services, where his friends are providing a high-tech surgery. He here is limited, still providing the services like he's still in the 1970s.
According to the World Health Organization, a doctor-patient ratio of 1 to 600 is the basic standard. In Katsina, it is 1 to 100,000. The situation is further exacerbated by the emergence of bandits' attack in Katsina. The new state government says it has a clear strategic health plan in place to address the deficit in the sector.
The agenda, especially of His Excellency, the transformation agenda, health component in that respect, concurs or it keys into the health system, touches virtually every component of the health system, especially the human resource for health.
Dr. Samini is worried after witnessing 2 of his colleagues collapsing due to workload. In this state of distress, more doctors will certainly leave the state services. Jamil Mobay, Trust TV, Katsina.